members here are also working with providers on getting them education. And April has something else that she would like to say.
Yeah, we will get an advance notice from Medicare in early spring of how they plan to determine which diagnosis codes in the ICD-10 model and how they will map into ICD-10. So we don't yet know which codes will fall into the new HCC model with the transition to ICD-10. We should know early spring. At that point, we plan to do some mapping based on the current diagnosis codes we use today to see if just by pure nature of switching to ICD-10, it's going to have an impact on our revenue, or if it appears to be about an equal as we are today. We know ICD-10 coding is more involved, more specific. We have heard some rumblings in the community that they may have coders helping physicians initially with ICD-10. That obviously would be very helpful because I don't think physicians will have been through a lot of personal training around ICD-10 to be able to really navigate that and know how to select those codes appropriately. But we are actually starting to introduce at least general orientation and training in fourth quarter for providers around ICD-10 the best we can to know how that will affect HCCs and the risk adjustment modeling, but we really won't have a complete picture until spring. Does that help? Yes. Okay. Any other questions about risk adjustment?
So yeah, I'm Bob Parker. I'm the Chief Medical Officer with Health Alliance Medical Plans. I'm an old dog that came back. I was here as a practicing internist administrator for 18 years and then left in 2000, took a position in Chicago and was in Chicago for 9 years, and came back in late 2008 in my current role as Chief Medical Officer for the health plan. So I'm delighted to be here, and Dawn has assured me that I cannot take more than 30 minutes, so I will be given the hook in 30 minutes, and my task tonight is to give you all a little brief overview of the Star Ratings program. Before I do that, I'll digress. My sound bites that I would have on the first segment are a couple. We're really fortunate with Medicare Advantage that we can do retrospective chart review. We are very, very fortunate. September 1st, which was just a couple of days ago, we got into the Medicaid managed care business. We brought in over 1,300 senior persons with disabilities, and as the state of Illinois rolls out Medicaid in 2014, by the end of 2014, we're going to have who knows how many Medicaid managed care folks. The risk adjustment model in Medicaid does not allow retrospective adjustment. April said that. I just want to underscore that. The Medicaid program, you have to code it correctly with each encounter, and so there will not be an opportunity to go back and retrospectively review the charts and potentially adjust the coding risk management model. And just keep in mind that as we transform